Hello everyone, this is Manur Ali and welcome to my channel Learn with Ease. In this video, we'll be learning about the serratus anterior muscle. The serratus anterior muscle, as the name suggests, has a serrated appearance. The serratus anterior muscle clothes the side of the chest wall. The serratus anterior muscle originates by 8 digits from 1st to 8 ribs. As you can see in the diagram, the origin of the serratus anterior muscle is from the 1st to 8 ribs. The first digitation of the serratus anterior muscle arises from both the first and the second rib. However, the remaining digitations arise from their respective ribs. For example, the second digitation arises from the second rib, the third digitation arises from the third rib, and so on. Now, coming to the insertion of the serratus anterior muscle. The insertion of the serratus anterior muscle is onto the medial border of the costal surface of the scapula. Now, coming to the nerve supply of the serratus anterior muscle. The serratus anterior muscle is supplied by the long thoracic nerve or the nerve to serratus anterior, also called as the nerve of Bell. The root value of the nerve of Bell or the long thoracic nerve or the nerve to serratus anterior is C5, C6 and C7. Now, coming to the actions of the serratus anterior muscle. The serratus anterior muscle is also known as the boxer's muscle because the serratus anterior is a powerful protractor of the scapula which helps in the punching action. The serratus anterior muscle also helps in keeping the medial border of the scapula in firm contact with the chest wall. It also helps in rotating the scapula laterally and upwards during overhead abduction of arm, along with the trapezius muscle. Now, the clinical correlation of the serratus anterior muscle is the winging of scapula. Whenever there is damage to the nerve of Bell or the long thoracic nerve or the nerve to serratus anterior, either due to a stab wound or due to removal of breast, as in the case of breast cancers, it leads to the paralysis of the serratus anterior muscle. As a result, the protraction of scapula is weakened and the inferior angle and medial border of the scapula become more prominent when the patient pushes his or her hands against the wall. This is known as the winging of scapula. Thank you so much and have a nice day.